Our next issue is not a harmful health concern, but it does impact self-esteem. Cellulite causes the skin to dimple and appear lumpy, especially in the thigh and buttocks area. The latest medical technology goes to the root of the issue, fat deposits beneath the skin's connective tissue. The result is a smoother appearance. Go ahead, break out those Daisy Dukes. Joining us with how the minimally invasive procedure works and the other cosmetic concerns you can take care of at the ACPS Surgery Center and Med Spa, our board-certified plastic surgeon, Dr. Kristi Hustak, and nurse practitioner, Christy Craig. Hello there.
Hello. We're excited to be here today.
All right. I am always excited to see a good plastic surgeon, right? All right, Dr. Hustak, you specialize in all kinds of things. I mean, the face, the body, the breast, expertise in the mommy makeovers, the breast augmentations, BBLs, vaginal rejuvenation. I want to get to that in a second because I think a lot of people misunderstand what that is. But there are those other issues that don't necessarily require surgery, but it's more of a procedure. Yeah. So let's first talk about what is the purpose of cellulite? It needs to stop right now.
There is no purpose for cellulite, which is why it's got to go. So, cellulite is such a complex problem, right? I am embarrassed to say how many lotions and potions I have in my own medicine cabinet to combat this issue. Very prevalent, 90% of women, and I say women
90%.
Because there's an estrogen component. So this isn't something that's associated with just you're not working out enough, you're weight shifting. I mean, this is like a real problem related to estrogen.
Yeah. So extra weight can make it a little worse, but I have seen skinny people. I'm going to tell you, there is 100%. A supermodel that we all know, had a little pocket of cellulite, and I was like, what?
And most of these gals that come to get these releases will tell you, I've had this my entire life, this dimple. So, but Avéli, which we're talking about today, is the best tool I've had in my toolbox in the last decade to combat cellulite.
And what does it do, and how does it work?
So Avéli is a device, this is it here, it's a sleek little device that you can release these dimples permanently. Wow. And so this device is really simple to use. I use it in the operating room in conjunction with other procedures. Christy uses it in our medical spa under local, but I'm using it with BBLs. I'm using it in my gals that have already had BBLs to kind of smooth everything out.
BBLs, explain what that is.
So fat grafting to the buttocks. Okay. So really kind of building out some projection and shape, which in Houston is quite popular. And then also with other kind of lower body rejuvenation stuff. So just that kind of wavy skin laxity, that increased kind of dimpling that you get as you age. So I kind of use it with that combination with skin tightening devices like Renuvion.
And to give people kind of an idea what we're talking about, so like if you like scrunched your skin together, sometimes you can see cellulite where you wouldn't have otherwise, right?
Right.
But so the idea is that there's those bands underneath there are kind of keeping it scrunched together. Once you release it, it smooths things out.
That's exactly it. So it's these fibrosepti bands that connect the skin down to the underlying structures, and those are there genetically post-menarche. So after you have your period, surges the estrogen, and then over time the skin kind of dimples and gets thin on top of it. So this goes underneath the skin, under local while you're sleeping or in surgery when you're already out. And it's got a little hook on the end of it that hooks that dimple, and you see it like on the outside. It's like awesome. And you just release it with the little internal blade that it has, and it's gone forever. And it's kind of like a tree trunk. So there's lots of little bands underneath there. So this is nice because you can verify. You can go back in and make sure it's released, and then you never have to worry about it again.
There are sometimes when you need the full meal deal, you need the full surgery.
Right. This is a piece of the puzzle, a tool in the toolbox.
But what's great about you is you have your med spa component, which is where you are, Christy. And so there are all kinds of things that people can get done there. And you use Avéli in a little bit different way as well.
Differently. Well, the same procedure, but we need to make sure the patient's comfortable. We use nitrous oxide, which is laughing gas, which is safe. The patient can use that throughout the procedure. They can use it at the very beginning of it just to get comfortable. Then we inject also lidocaine and epinephrine, which is a numbing solution, into the tissues.
Let me just tell you right now, if that cellulite goes away, or the look of it goes away, we don't care what's going on.
No pain, no gain.
Right. But there's so many other things that you have as well that can smooth out, lift up, tighten other areas without going under the knife. Morpheus radiofrequency energy to stimulate collagen.
Sure, we can use all of that in conjunction with Avéli. Avéli, if somebody has cellulite, Avéli will disrupt the band, release the band. The Morpheus, it can help to even out the areas that Avéli does not. Like if there's any lumpy bumpies from fat distribution, we can target the fat area with the Morpheus microneedling and smooth that out. We can also help to tighten the superficial layers of the skin with the Morpheus.
And the radius and sculpture.
Yes, those are collagen biostimulators, so that can be used in conjunction also with Avéli. If you think about the BBLs, these injectables, the radius and the sculpture are what can can build the collagen and build volume as well, just like BBLs.
Yeah, definitely what we're seeing a lot, and kind of what she spoke about is after those dimples have been there for years, you go and release them, 20 years later, there's a volume deficiency. And so that's really what these stimulators help with, whether it's fat in the operating room or these collagen stimulators will help build that back up. So I can release that dimple, but you still have a little bit of a shallow divot. So those things help dramatically, and it all is kind of done together.
And there's so many other things in the med spa, because you can go in there, you get your fillers, your Botox, your release the wrinkles, all that type of stuff. And sometimes it can be the kind of the bridge between when you might need something a little more aggressive, right? So sometimes somebody may come into your office and you go, well, I don't think you're really ready for that yet. But if you might try some fillers to see how that looks, or you might say, let's try this. If you like it and you want that to be the permanent fix, well, then we can bump it on up to a surgery.
No, they work great in conjunction, either for maintenance or for preventative.
Yeah. Who's a good candidate for Aveli?
So this is really targeting those fibroseptal bands, so those true dimple cellulite. That's a little different than kind of what we call wavy cellulite or skin laxity cellulite. Sometimes those two are together, but those are a little bit different. So usually I tell gals these are targeting those dimples on the butt, the back of the thigh, or the outer thigh. This doesn't go after knees, it doesn't go after interior thighs. Those are different bands.
But where you talked about is where it's most visible and usually most of the time the problem,
Absolutely,
right?
Exactly.
Is it one and done?
One and done. So this is a verifiable long-term result. So this is not something you have to continue to do. Lunchtime procedure, an hour. In the OR, it takes me an additional 30 minutes, and then you are done. Now, this doesn't mean you're not going to get skin laxity kind of stuff later in life.
Yeah.
Totally different.
All right, I want to go back to vaginal rejuvenation, which you do, which a lot of people you kind of misunderstand that, but I can't tell you how many women pull me aside and say, I'm having this problem, like when I laugh, I'm gonna wet my pants, or I this, or I that, or they've birthed 4 children. Well, there's an impact of that sometimes.
No, for sure.
Right? So explain what it is that you can help with in your
Yeah,
office.
so kind of similar to lots of things. There are surgical and non-surgical options for this. I know you and I chatted about 8 years ago on the same topic, and it's still
you
a
were
hot
pregnant
topic.
at the time, and you have an 8-year-old now.
I've got 3 kids, so I know what I'm talking about. But yeah, no, definitely. So there are some lasers. So heat, again, can really go through the vaginal mucosa, tighten things up, lift things up, help with some early stress incontinence. So cough, laugh, sneeze, jump, lose a little bit of urine, which is incredibly prevalent as well.
And then intimacy issues.
And then intimacy, it kind of helps wake things up down there. And then there's some surgical repair. So this is a point of weakness, so everything kind of falls into that space. So this kind of helps push things back out of the way, tighten up those muscles. Just similar having to a baby with stomach muscles, your muscles down there can get lax too.
Yeah.
So there's some surgical options to tighten things back up in there and make sexual intimacy, that friction component, a little bit better.
Yeah, all right.
Yeah.
Okay, this is like my maintenance program right here. If you're ready to say goodbye to Cellulite, ACPS is offering 2 special offers. Right now, receive 10% off your Aveli treatment through the end of November with ACPS Med Spa. You can also receive 20% off your Aveli treatment with Dr. Hustak when booked in combination with any surgery in the operating room. To book a consultation with Dr. Hustak or ACPS Med Spa, give them a call. Here's the number, 713-799-9999. Again, that's 713-799-9999. Put that on speed dial.